Hi, my name is Matt Shade, and I'm an athletic trainer here at Performance Spine and Sports Medicine. Today we're going to be looking at injury awareness for baseball and softball athletes. The objective of today's presentation is to look at the anatomy of the shoulder. We're also going to take a look at the factors that contribute to injury, as well as biomechanics, treatment, and some prevention tips. When looking at the human body, you always have to keep in mind that everything is connected. Most of the time, shoulders injuries are the most prevalent injury in baseball and softball players. However, it all starts in the kinetic chain. So let's take a look at the shoulder. The shoulder is comprised of the rotator cuff. It's the most common muscle group that people associate with shoulder injuries. It's really four muscles: the infraspinatus, supraspinatus, subscapularis, and teres minor. And those muscles work together to help stabilize the humeral head on the glenoid. It's a ball and socket joint, so the key component is making sure that ball stays inside that socket. You also have your labrum and ligaments, and the muscles, the ligaments, and the labrum all have to kind of work together in order for the shoulder to function. A common injury, again, is the rotator cuff. You can have tendinitis, you can have impingement, or you can have tears in the shoulder. When looking at impingement syndrome, what happens is, as the baseball player brings his arm up to make that throw, you get a pinching on that rotator cuff. Over time, it can create tendinitis and inflammation of the muscle tendon. You can get bone spurs. The way you want to treat impingement syndrome or tendinitis is with rest and ice, and then maybe you need to take anti-inflammatories. More aggressive treatment includes cortisone injections, and most importantly, you want to do a good physical therapy program as well as chiropractic adjustment so that shoulder is balanced. If you have a tear, it doesn't always require surgery. Physical therapy, cortisone injections, and chiropractic adjustments are good alternatives for the partial tears. The full thickness tear, you have to determine how functional the shoulder is. If you've lost complete function, then you will need to have surgery. The labrum, again, is the cartilage that kind of deepens the socket. And labral tears happen when the humeral head is no longer stable. That rotator cuff fails, and now the humeral head creates a lot of friction in the socket joint, tearing that labrum. Tears are usually classified by the location, so you may hear of a slap lesion or a Bankart lesion. It's, again, just a labral tear, but it's based on location. Factors that contribute to injury. Most of the time, and especially in young baseball players, it's muscle fatigue or weakness. Pitchers can usually have weakness up to 2 days after throwing. Young players, you're playing on multiple teams. So therefore, you go out, play a game Monday, you're on the field again Tuesday, the body doesn't have enough time to recover. If there's any strength imbalance or muscle dysfunction through the kinetic chain, you're also exposed for injury, and decreased range of motion. Looking at the biomechanics. For a pitcher to throw a pitch, the arm has to accelerate at 7,000 degrees per second. Now, the larger trunk muscles as well as the scapular muscles are responsible for getting that arm in motion. However, the smaller muscles, the rotator cuff, are responsible for slowing down and decelerating. If there's any imbalance, especially on the deceleration, you can easily have a shoulder injury. 6 phases of throwing. This kind of gives you a better visual. You have your wind-up, your early cocking, late cocking, the acceleration. These are all big muscle groups that are firing and working. Now to the deceleration, the smaller muscles are responsible for slowing you down. So that gives you a nice visual of a pitcher going through. Now, it's important for coaches to realize, as well as young players who are trying to idolize after their favorite baseball player, that not everybody's going to throw the same way. So really, as far as technique is concerned, we're not too concerned about that. What we're more concerned about is the biomechanics. We want to make sure all your muscle groups are firing the way they need to. Also, looking at, if you're a pitcher, your grip is more important than your actual arm location. You also have to be careful, coaches, if you are coaching a young team, usually your pitcher is your best player. He's going to be on the mound. He's going to throw 4 or 5 innings. He reaches his pitch count, and then he goes out and plays shortstop. The way a shortstop throws is different from a pitcher. Your windup is no longer in play, and you're usually throwing while you're on the move. Early signs and symptoms. You always have to listen to your body and respond. A lot of times kids will come to you and say, "Coach, I don't have the high heat today," or "I just can't get loose." These are some early signs and symptoms, and they should be taken seriously. The general pain will progress to get worse. So most importantly, don't ignore the early signs. What will happen is the shoulder will now be injured, but then you're also going to apply additional stress to your elbow or to other body parts. The most common is little leaguer's elbow, medial epicondylitis. It's inflammation there on the inner aspect of the elbow. Tommy John surgery is a tear of that ulnar collateral ligament injury. And for those of you who may not be aware, Cole Hamels actually fractured his growth plate as a sophomore in high school while throwing. And I can almost guarantee there were some early signs and symptoms that he ignored to play. So if your athlete has any type of pain in the shoulder, the best thing to do initially is rest, ice, compression, and elevate. Just shut them down and let them recover. You then want to see a physician for proper diagnosis. We have to determine why you're having that injury. And here at Performance Spine and Sports Medicine, we have sensor technology that we don't only look at just the shoulder, but we look from the feet all the way up to the fingertips. And as the pitcher or thrower goes through his motions, we can see if there's any muscle weakness or any muscle imbalance. And then we'll begin an appropriate physical therapy and strength and conditioning program for that athlete. Some prevention tips. Again, start off with your biomechanical analysis and then begin your physical therapy. We leave the pitching techniques and stuff up to the coaches. We just give you guidance on what you need. It is important to have a year-round training program. You want to focus on core strength. These are just a couple exercises that you can do. You also want to focus on stretching. Not just stretching the shoulder and the arm, but legs, hips, as well as the wrist and the forearm. For prevention, we also focus a lot on scapular strength. For every front exercise an athlete does, they should be doing a back exercise, really pulling the shoulder blades back. It's a very common muscle imbalance there. And for pitch count, there's a lot of stress right now, especially in Little League ball players, about pitch count. But I like to consider throw count. Think about the number of warm-up pitches that you have, as well as are you playing multiple positions and are you on multiple teams. So hopefully you can take some of this, apply it to your practice and your games, and good luck this season.